Hello and welcome to Leicester Spot Diagnosis, the page that uses social media to enhance peer-led medical education. I'm going to carry on with the rapid-fire answers, and we're in the orthopedic block, and this is where we left off. Let's give you some more answers. Okay, diagnosis, a nice easy one here. What is the diagnosis? This is osteoarthritis. What are the radiographical features of this diagnosis? Well, there are 4 features to know about: sclerosis of the bone, subchondral cysts, osteophytes, and erosions. Look at these lovely little subchondral cysts, very clearly seen here. Next case. What is the diagnosis? Now, this is a condition much less common than osteoarthritis. This here is Paget's disease of the bone. It is worth saying of the bone because there is also Paget's disease of the breast and Paget's disease of the penis. Some of the complications, they are hearing loss, high output cardiac failure, kidney stones, and osteosarcoma. Now, osteosarcoma typically affects children or adolescents, but there is a little peak later on in life. I think it's the 50s and 60s. It's the time when Paget's disease affects people. And osteosarcoma has a second peak bimodal distribution because of Paget's. Next case. This person is an electrician. Is he good at his job? Explain. Now, what on earth has an electrician got to do with it? Well, this is a posterior dislocation of the left glenohumeral joints. We can see that the head of the humerus is a long way from the glenoid fossa, and the contour resembles the contour of a light bulb. Which it doesn't look like a light bulb if the shoulder is not dislocated. Now, the electrician thing is because electrocution can cause posterior shoulder dislocation, so can being struck by lightning and fits. 10% of shoulder dislocations are posterior and the remaining 90% are anterior, so this is the rarer form. Next case. This is a total hip replacement, so here I'm asking you, what investigations would you request for this patient if you saw them in the pre-op clinic? So, you want bloods, first of all. You want FBC. Is the patient anemic? If they are, this could put strain on the hearts and cause tissue hypoxia during surgery or lead to an MI. Use and ease. You want to know their renal function. Do they have any renal disease? And you want to know a baseline to be able to care for them post-operatively. LFTs. Is there any liver disease? Is there any malnutrition which may affect wound healing afterwards? Calcium. Any underlying malignancy? Clotting. Especially if they're on medications which affect clotting or if they're known to have any clotting disorders. Urinalysis. Dip their urine. If you pick up diabetes, that's going to be hugely significant for planning major surgery. There's a few other tests: group and save and cross match at your discretion, depending on how at risk you think the patient is and depending on their past medical history. The same with chest x-ray and spirometry. Again, your discretion and their past medical history will guide you. And also a Mallampati score, a height, a weight, and a BMI will all be useful. Okay, what are the main risks of this surgery? Well, you can say infection and bleeding, DVT, PE, but these are not specific, obviously, to total hip replacement. But some complications specific to this procedure are foot drop, discrepancies in leg length, dislocation, a rate of about 2% of dislocation, and loosening of the prosthesis. Okay, next case. This patient has a painful shoulder. Why? Well, you can see here, this calcification shouldn't be there, and this is calcification of the supraspinatus tendon, which is inserting itself onto the greater tuberosity, greater tubercle, pardon me. When the patient abducts their arm, this gets jammed on the inferior surface of the chromium process of the scapula and between the greater tubercle. Next case. What is this prosthesis called? This is a dynamic hip screw. What fracture did the patient have to get this? Well, they had an extracapsular fracture rather than an intracapsular fracture. And what is the mortality rate for a fractured neck of femur? Well, some papers put it as high as 50% in 1 year. Total hip replacement, fine, you're selecting a population who are fit for surgery. But the old lady who's fallen over, who's not particularly fit for surgery, as many of them as many as 50% can die within 1 year of this surgery. And contributing factors may well be DVT, PE, pneumonia from bed rest, pressure sores from bed rest, and stroke, MI, or renal failure from the stresses of surgery and anaesthetic. That's all for now. Find us on Facebook if you haven't done already at Leicester Spots Diagnosis, and more short, rapid fire answers will follow.